My name is Autumn McCoy. This is for NUR 435, and it's a central line dressing change care. So before I'd walk in, I'd make sure that the patient was in his correct time period of changing, so set no longer than 7 days. I would do hand hygiene. I provide patient privacy, and then I would do hand hygiene, and then I would explain to the patient what I would be doing. So I would get my gloves, I would put on my mask, and make sure that the patient had a mask on too, and would have their neck kind of rolled to the side. So when taking off the dressing, I will hold the skin so that I'm not ripping the skin off as I'm pulling it. And then I would assess the old dressing to see if there was any concerning drainage, or if there was a foul odor, and if there was, then I would make sure to get a culture of it, swab it, and then I would let the physician know. So now I will be opening up. I would do hand hygiene again. Then I would open my kit. And then my gloves rolled, so I would make sure to get a new pair. Get rid of that. And then in practice, I would use chlorhexidine or iodine, but for the video, I'm just going to use alcohol wipes. So within my sterile or my packet, I have these swabs, and I would make sure to use one, making sure to go up and down and side to side, about 2 to 4 inches away from the site, and for about 30 seconds for each swab. 30 seconds, throw that away. Same thing with this one, do up and down, side to side. And I touched the mask, so I'd have to get new gloves. But 30 seconds with this swab, throw it away. And then with this last swab, I would want to make sure that that whole area was clean. But then I'd also want to kind of go down the pick line to make sure that the tubing and everything was okay. So now that I've cleaned it, I would wait for it to dry. And then while that's drying, I would make sure to prepare this. And let's say it's dry now. So covering it, I would want to make sure that I can still see the access to see if there is any drainage or anything concerning. And then I would take this piece and make sure to initial and date it and put it just on that dressing, but not where it would be covering. That's okay because the dressing change is done. Not where it's covering the access. And then I would document how the patient tolerated it, if they had any concerns. I would document if there was anything on the drainage or if there was a foul odor, and then of course notify the physician if any of those concerning things happened.